Dear friends, welcome to our channel. And today I want to talk to you about gallbladder disease. It's a massive topic. It's a hot topic. And there are a lot of misconceptions about it. Well, let's start with why gallbladder disease occurs in the first place. For example, the most common ones are dyskinesia, cholecystitis, and gallstones. We're mainly going to be talking today about dyskinesia and cholecystitis. So, why do these diseases occur? Well, the first reason, which everybody knows about. Some sort of nutritional deficiencies. That's obvious. And again I say, many people know about it. What few people know is that gallbladder problems with the gallbladder are caused when you're sedentary. That's why dyskinesia and cholecystitis are often suffer from dyskinesia and cholecystitis. Students who sit at a desk all day, studying. Pensioners who don't move much, and office workers too. Why does a sedentary lifestyle cause gallbladder problems? It's because when you move, the gallbladder, shall we say, is massaged, and in that massaging, it's easier for the bile to squeeze out of the bladder and circulate better. So if we want to deal with gallbladder disease, the first thing to do is to start moving. But we'll come back to that. Now I'm going to talk about the third cause of gallbladder problems, that almost no one knows about. Oddly enough, it's stress. Now, many of you are probably surprised at that statement. Why does stress affect the gallbladder? Meanwhile, it is very easily explained. Under stress, under nervous tension. The sphincter of the gallbladder tightens and the bile doesn't empty properly. The bile doesn't move out of the gallbladder properly, and it becomes stagnant. What are the consequences? First of all, dyskinesia, and secondly, cholecystitis. By the way, what is dyskinesia? Many people do not understand this word. I will try to answer simplified. Dyskinesia is a disturbance in the movement of bile through the ducts and stagnation in the gallbladder. So there are no organic lesions. So, roughly speaking, the anatomy of the bile ducts, the liver, the gallbladder, it doesn't change. But the outflow of bile, the physiology of this movement, it is disturbed. What symptoms are manifested by dyskinesia? First of all, this is pain under the ribs on the right. Now, these pains can be aching, more often than not. It's a nagging, dull pain. But sometimes they can be sharp. This pain can be 15 to 20 or 30 minutes after eating. And it may not hurt for long. And sometimes the pain becomes almost constant. That is, it lasts for several hours. Once again, the characteristic symptom of dyskinesia is a nagging, dull pain in the right subcostal region. In addition to the subcostal pain, you can have some rather unexpected symptoms. There's constant fatigue, some irritability, sometimes even weakness, sleep disturbances. And then, obviously, there's some kind appetite disturbances. Some people have a decreased appetite, some people have an increased appetite, on the contrary, increases. This can also be a manifestation of dyskinesia. Bilestasis, which occurs with biliary dyskinesia, can eventually lead to inflammation of the gallbladder. Or, in medical parlance, cholecystitis. Cholecystitis can be calculus, which is calculus, there's non-stone, there's non-calculus. But we're going to talk about non-calculus today. Cholecystitis. How does non-calculus cholecystitis manifest itself? Well, the same symptoms, actually, as dyskinesia. Right subcostal pain. But the other thing is that they tend to be more severe, more intense. They tend to be more pronounced with any kind of dietary disturbance, even when you're shaking when you're in a vehicle or a car. And these pains become particularly severe if there's an infection attached to the disease. That happens too. I mean, certain microorganisms can exacerbate the inflammation in the gallbladder. And then the pain becomes more intense. So the question becomes, of course, what do we do about all this? Well, first of all, we need to get a proper diagnosis. What tests do we need to run? The most obvious one that comes to mind is an ultrasound. Ultrasound is the first method we use. We start with the gallbladder. It's a very important test, in my opinion. From my point of view, and I prescribe it to a lot of people, is a CT scan. That is computed tomography of the abdominal cavity. The third method of examination is the probing of the gallbladder. This method is performed in some medical institutions to determine the composition of bile. Well, and the fourth is a blood test. Blood tests will tell us what kind of abnormalities in the liver function of the patient. And in fact will help us make adjustments to treatment. Now we're getting to the treatment. Of course, ideally, if you're treating for gallbladder disease, you'd have a competent gastroenterologist. But it is not always possible to find such a doctor. So now we're going to go over through all the points of our therapy. Obviously, you'd have to start with a diet. But we'll come back to diet a little later. A very important method of treatment is, of course, special therapeutic exercises. You can find these exercises on the internet. So these exercises can help with pancreatitis for pancreatitis and for cholecystitis. But you can only do them if we're sure you don't have large gallstones. Because otherwise there can be a blockage. The next treatment that I really like is the use of herbs. What's particularly good is that these herbs, that I'm going to list now, they're not just for cholecystitis. They also help with pancreatitis. So these herbs are dual-action herbs. Not only do they treat the gallbladder, but they also treat the pancreas. What kind of herbs am I talking about? Well, first of all, it's what I talked about on the show about pancreatitis, is corn stalks. The second herb that I really like is milk thistle. Number 3 is dandelion root. And number 4 is burdock root. These are dual-action herbs used in the form of decoctions, infusions. They're good for restoring gallbladder function, and they're good for restoring pancreatic function. That is, they are very useful. Of those herbs that treat specifically for the gallbladder, I would say immortelle and yarrow. And calendula. It's good for you, by the way. It's not only good for the gallbladder, but it's also very good for the stomach. Of pills, I would recommend this drug, which, by the way, I also mentioned in the video about treating pancreatitis. It costs very inexpensive, this drug. It is called acpentylat. It's a very good and, in my opinion, useful drug. What are its indications? Well, first of all, cholecystitis, dyskinesia. Very well, this drug helps with so-called atonic constipation. That is, when the intestines do not work well. And this drug is also useful for those people who have had their gallbladder removed. So it's a very good drug, very inexpensive, but it has important contraindications. First, in addition to hypersensitivity, this drug is not suitable for anyone who has any particular sensitivity to the components of this drug. But most importantly, I want to emphasize again that this drug should not be used with gallstones. That's one. 2. You can't use it for acute hepatitis as well. That is, if there's an exacerbation liver disease. If you have peptic ulcer disease, duodenal ulcer, we don't use this drug either. Well, and I talked about it on the program about pancreatitis. If you have acute pancreatitis, or if you have an exacerbation of pancreatitis, this drug is also contraindicated. Otherwise, it's a very good and useful drug. And now we move on to the next method for the treatment of dyskinesia and cholecystitis. This is the use of mineral waters. As with pancreatitis, with cholecystitis, they're very useful. And I will remind you that they must be used in a special way. So you open the bottle beforehand, let the gas escape, and drink it warm, not cold. The course of treatment with mineral waters is not very long. I mean, not a few months, but somewhere, on average, 3 or 4 weeks. Well, and now we move on directly to the diet. It's not a super strict diet, but there are still some things should be kept in mind. First, we eat 4 to 5 times a day. But these 4 or 5 times a day for cholecystitis and dyskinesia shouldn't turn into constant snacking. That is 4 to 5 times a day, not very large portions. And no snacks between meals. This is the first. What is forbidden in cholecystitis and dyskinesia? First of all, no very hot drinks or food. We remove any dishes, any soups with meat, fish, and especially mushroom broths. So no meat, fish, or mushroom soups. Next, We're eliminating any dishes made with fatty types fish or meat. And of course, no smoked meats. And processed meats. So no sausages, wieners, sausages, and so on. We're going to eliminate particularly fatty foods like pancakes and fritters. These are the foods that often cause pain in the gallbladder. Some of the less obvious ones: cocoa, chocolate, ice cream, sour apples, and of course, alcohol. One last thing I should say. In cases where, for example, cholecystitis. For example, when you have an infection, that is, when it comes with severe pain, fever, that's when you're supposed to take antimicrobial drugs. And I often recommend to my patients the same drug that works well for the treatment of gastritis and peptic ulcer disease of the stomach. It's Flagyl.